Good afternoon, everyone. That is on East Coast. Good late morning for those in the mid country, and good morning for those on the West Coast. Today, we're going to do a 30-minute webinar. 20 minutes will be us just kind of speaking about our current new product called ImpactClarify. I'm happy to say that we've got a range of people that are joining us. Multiple TPAs, a lot of different brokers, look like some Union and Taft-Hartley groups, also some other point solution individuals. So welcome everyone to the webinar. We can go to the next slide, please. I will moderate our discussion today. My name is Mark Mason. I'm the President and Chief Operating Officer here at Renalogic. Been in the what I would call in the PNC and the healthcare world for about 31 years. And really happy to be here to talk about our new service offering to the marketplace. Before we get into that, I'm going to hand it over to Doug to do an introduction of himself for a quick minute here so everybody knows who each other are. Thank you. Doug?
Yeah, my name is Doug Aldine. I'm an attorney here in Austin, Texas. Been a lawyer for 32 years, been in healthcare for 25. Started out my hometown in Champaign-Urbana, Illinois, in the provider-sponsored HMO world as an associate general counsel, and then moved to San Antonio as a general counsel for an organization called Community First Health Plans, another provider-sponsored HMO owned by the University Health System. So I've been inside health systems almost 10 years. And then I've had my own firm since 2007, exclusively working with folks in the self-funded world.
Perfect. Thanks, Doug, for the introduction and the background. Go on to the next one. So thank you. So as we mentioned before, our new service offering in the Renalogic suite is called ImpactClarify. And really what this is doing is three things. One, it is taking something that is complex as it relates to the total cost of a claim or multiple party claims, and teasing out who the appropriate stakeholders and responsible parties are as it relates to all the claims that are occurring. These claims can be anything from obviously group health claims, they can be fully insured claims, but ultimately they have cross sections with auto liability, first and third party, workers' compensation. It could be product and or malpractice. It could be also anything in regards to negligence or additional liability that would be from any other stakeholders. And really what we want to occur here is ensuring that the right people pay the right and the correct amounts that are owed by them by the current plans and or responsible parties that they have. We want the right amounts to be paid by the right people, which is also different than the appropriate people that may be treating these individuals from a claims perspective. And then ultimately, we want to make sure that everybody is accountable for all of the dollars that are due, and then more importantly, protecting those dollars on a future-looking perspective. So once everything is kind of signed and sealed as it relates to these kind of multi-seven-figure and higher claims, that people can walk away and feel good that all the parties really have been taken care of and certainly been appropriately allocated from the coverage in which they're a party to the claims. One of the things that I think is really important here is that while most of our experience, certainly from Doug and mine on the self-insured side, this does have cross kind of pollination into Medicare, Medicaid Advantage, Medicaid, dual eligible, because those individuals and those plans would also be party to several of these claims. And keeping track of all of these things is very hard to do in a single view, because everybody kind of stays in their lanes. So we can go to the next slide. Thank you. So what we have coined as a key denominator for the ImpactClarify service is multiple accountable parties claims, which we're going to abbreviate to be MAP claims. And really, again, these are going to be claims that in isolation would seem very simple. Something like I was driving, I was inebriated and I was driving, and I had an ER visit that was a part of that. under coverage. The self-insured employer would say you're no longer eligible. The coverage doesn't claim responsibility for the negligence of that member, and then off they go. The problem is that when you have multiple parties part of an accident or a claim that have coverage and responsibilities, we need to make sure that there is somebody in the middle that are tying all of those people together. The other things that can happen is a lot of these cases, unfortunately, just through the due diligence, through audit controls, and even some of the historical documentation, sometimes the party that gets billed the first pays immediately without really doing the due diligence about who should also be privy to the coverages of those claims. And that's really the key indicator. So we're really trying to keep the multiple accountable parties all in the range of kind of control, as well as ensuring that those parties are working together to ultimately ensure that there is a final outcome that everybody can agree to and walk away from and feel good about. Go to the next one. So I'm going to hand this over to Doug here to walk through a really good, I think, example of what we would call a MAP claim. And then we'll talk a little bit about how the economics and the association works after this. Go ahead, Doug.
Absolutely, Mark. Thank you. All right, so let's just take this step by step. Looking at step one, Mary's 66 years old, so she's Medicare eligible, is a home health nurse. She's driving between patients, workers' comp, okay, and is hit, the other driver's at fault, who was overserved alcohol at a local restaurant, okay? Mary has a head injury, broken ribs, a punctured lung, and multiple fractures in her arm and shoulder. The head injury, the broken ribs, okay, I'm moving through here. She's admitted as an inpatient, and I can't see in terms of what the dollars are, but she's got obviously, several $100,000 in claims. And as she continues to start unraveling the different pieces, she's working at the time of the accident, so you've got workers' comp coverage. Okay, she was hit by an impaired driver. Okay, she's got an at-fault driver. We don't know his level of coverage. You've got to figure out what that amount is. But she's also enrolled in Medicare, so you're going to be looking at Medicare set-asides, because anything related to those injuries are going to be set aside, for future treatment. So Medicare's, the payer of last resort. However, the bill is sent to Mary's employer, but the employer ultimately is not the responsible party. The total bill right now is $1,345,643, and so now we have to untangle all of this and then reconcile it between all the respective parties.
Perfect. Thanks, Doug. All right, so let's carry on the scenario and talk a little bit about our process here. So the first part, we just call it ACAP to keep things simple here, is we analyze, we clarify, we agree with all the parties, and then we process the claims and the dollars in which now need to ultimately be paid to the different types of providers, and then ultimately to possibly Mary and any kind of future medical treatment that would need to be responsible for. So on the analyze side, as Doug indicated, is that we have two providers that ultimately are asking for payment in regards to this particular claim. We've got a hospital bill that is a little over $1 million. We've got an air ambulance charge that is separate and typically out of network that also is asking for claims. And we know for a fact that there is already going to be representation about any kind of future medical dollars that need to be allocated for Mary's treatment ongoing, separate from the episodic event. So what does that really mean? So Doug, really started talking about the parties that are inside of that. So inside of all of these things, we've got a member, we've got the self-insured plan, we've got a stop-loss carrier, we've got auto liability, first and third party, we got workers' compensation, we've got a restaurant liability situation, and then we also have Medicare to take into consideration. And that's a lot of parties when you take a step back and trying to figure out really, okay, now that we know all the stakeholders are involved, and maybe there would even be more, but now that we understand the stakeholders involved, now we need to determine the appropriate coverages that are at least available, not necessarily responsible for it, but really what are the available kind of coverage sponsors that would come into play. This is where we get into the clarify stage. The clarifying stage is really going to be a mechanism to gather all the appropriate documentations, all the plan design information, all the coverages that would go along with it from all the parties that could be related to this. And really what we're trying to figure out here is, okay, taking at face value, how would this all work out without a discussion amongst the parties and assuming, everybody, is going to walk away trying to pay as least amount as possible. Well, you've got Mary that has responsibility for, a $10,000 out-of-pocket max. You've got an employer plan that's looking at, after, negotiation and network charges and everything else, $428,000, kind of best case scenario. And maybe that gets transferred to stop loss, maybe it doesn't. Depends on the spec limit. Then you've got a stop loss carrier that could step in, right, from, first dollar. We've got a first and a third party liability that has maximum kind of coverages, along with the undisclosed negotiation of like what happens if certain events happen even above the coverage limits. You've got workers' compensation that is certainly going to be in purview, that's going to own a responsibility party, assuming we're working on behalf of maybe the TPA who's working on behalf of the self-insured plan. The workers' compensation could also be self-insured. It also could be fully insured, depends on kind of what's going on in the situation. You've got the restaurant in which actually served the person who is overserved, who's going to gain some liability, who may have some coverage limits, and then you've got Medicare to take into consideration that now needs to be protected on any kind of future treatments that need to be allocated from a settlement. That's a lot of pieces to uncover to understand all the components inside this just one little claim that's starting at over now at $1.7 million when you kind of take a step back. Doug, I'm going to have you walk through kind of the agreement portion, really how things kind of get worked, and then how the funds flow really work in a scenario like this.
Absolutely. Thank you, Mark. So moving on to the agree provision here, you've got claims total of $658,189. And I think for this example, whether it's out of network, obviously you'd reprice the bills for the accident. If it's in network, you're going to pay the contracted rate. Same thing with the air ambulance. It's going to be out of network. You're going to negotiate that as best you can. And I will say this, there is some financial assistance available with air ambulance companies. Not a lot of people know it, but I've actually done it one time out of about 10. So, and then Mary may qualify for financial assistance for that $10,000 out of pocket, which she paid, which, if she qualifies in whole, she's going to get the $10,000 back. If she qualifies partially, it's going to be paid pursuant to what's called the AGB percentage. So as an example, if it's a 20% AGB, she's a partial qualifier. She's going to get 80% of it back. She's going to pay 20. So she'd be on the hook for 2, but 8 would come back to her. In terms of the process, we're going to manage this process. Okay. The employer's plan or the employer plan is going to pay $50,000. Okay. Stop loss carrier not going to have to pay anything because we've successfully circumnavigated that. So the stop loss carrier is going to be really happy with us. More importantly, the first party liability and the third party liability, they're going to pay what they're responsible to pay. So you've got the at fault driver, which is the third party liability. They're going to pay their $25,000 medical plus the $100,000. Then you've got, her own coverage, which is going to be the $100,000. So there'll have to be some reconciliation between those two parties, depending on what those policies provide. There's a workers' comp settlement, which will be subject to a lien, which we can work through as well. The restaurant liability for the overserving of the alcohol. And then most importantly is the ability to set aside money for Medicare for services down the road for Mary.
Perfect. Thank you, Doug, very much. If we go to the next slide. So lots of numbers, right? And this is not an eye test by any stretch of the imagination here, but really what I think we want to call out to is if this were to go unchecked in a way where we've seen, going through and doing audits before, there are monies that are just paid out because it's easier to pay out than actually try to deconstruct and reconstruct the multiple accountable parties in the mix of this claim. And really what ends up happening here is you have this before picture, which is the left-hand side, which is, the parties are paying is the monies in which that are kind of at face value. There may be some coverage discussion, at the TPA or at the plan level, or even at the broker side. They may say, look, this is not right. Like we need to think about this, and there may be some mitigation there for sure. But ultimately, what we didn't want to move from is an employer health plan having an exposure of $428,000 and workers' comp thinking that they may have a full exposure of 428. The plan may be self-insured on both sides, right? So it's on both sides of the pockets. But more importantly, what happens here is in the end, the third part is the total amount. Even after the negotiation, whether or not it's in network or networked related on the claim side, you end the story without kind of an ImpactClarify solution at one point, nearly $8 million, to a total of about $943,000. But look how the parties then now are being processed and who really owes the amount of money in the end. So not only in the aggregate has the number gotten smaller, the appropriate parties really have then kind of kept honorable to their coverages, as well as the responsible parties that owe a little bit more than what they would typically think that they would ultimately had to come back to the table and pay up some more money, which is exactly what we're trying to do. So what we're trying to minimize is the overexposure on the group plan, with the overexposure on the workers' comp. We're trying to make sure the first and the third party really pay the monies that are actually due. And then more importantly, we want to put a bow on it to make sure that future treatment that is taken into consideration and Medicare is, one, aware, and two, approves to the general output. So it's a really good ending to the story here. Doug, do you want to offer up?
I was just going to suggest, and even to supplement what you said, we're helping out the member. I mean, so $10,000, I don't care who you are, 10,000, those are real dollars. And so if you're able to transfer that risk back to the facility, I mean, that helps.
Yeah, it absolutely does. Go to the next slide, please. So really, again, this was a quick, webinar to really just get a taste for one, what the product and the service is that's, being offered through Renalogic. This is some information in which how to start the process. And we'll talk a little bit about that just in I think in here in a second. But it's a real simple ability for us to reach out to us, do a quick consultation, and then we can certainly try to get started. Thank you all for listening to the call. We do have, it looks like, 3 questions that are coming through. So I will tease these out one at a time. Doug, I'll probably throw one of these over to you.
Okay.
If you don't mind. So the first question is, how long does it take to implement this service? Implementation of the service is fairly simple. So it is reaching out to us. It is doing an assessment as to what the claim is, getting the necessary background to identify and really try to figure out who the stakeholders are involved. Once we assess that, circumstance, then we'll make a determination whether or not we think that there's an impact to be had, right? And if there is, well, we'll say, let's go forth, and we believe that, the following is available to the appropriate parties, depending on how we receive the referral. And then there'll be an engagement letter that will come with a scope of work that will talk about the work that needs to get started. And at that point, then it's really about finishing up the assessment, grabbing all the documents that would go along with that. So that's how things get started. And hopefully that answers your question there. The next one is, what does this cost to us? Doug, do you want to talk a little bit about kind of the recovery side?
Sure. I mean, absolutely. So in terms of cost, I mean, typically we would do this as a cost of savings, just because we've got the risk in terms of, making sure everything works correctly.
Perfect. Yeah. So one of the things that we realized is if there is, and air quotes, there, right? There's an opportunity to move it from a high aggregate to the responsible parties. We're really looking for that percentage of recovery that we actually demonstrated that one party or another did not ultimately have to pay or didn't pay. And some of this also could be retrospective. We've done situations where we've had to unravel payments that got paid in error, and we got to go back and refigure out, right, what's going to happen and untangle it. So that's one of the things that we want to do. There are some, what I would say possible fixed costs that go along with it. Anything from if there is mandatory arbitration or subrogation costs, which are minimal at best. If there's any kind of, clinical for the Medicare set aside clinical assumption, there would be a cost in there. Again, very, very nominal. We're really trying to identify these claims that are in the seven figures, that really have high exposure to multiple stakeholders. So, saving anywhere from 100 to 200 to 300, in this case, $600,000. Seems like something that is really set up for success and allows our expertise to step in where a lot of individuals just kind of have a myopic view on what's going on with the claims. Doug, I'm going to throw this question out to you since you've been out in the marketplace since 2007, doing what you do really well. Is there anyone else in the market providing this service?
Not really. I mean, there's a lot of different organizations doing it on a piecemeal basis, whether it's subrogation, whether it's, the workers' comp recovery, the Medicare set-asides. But really, I mean, think about this. I mean, you've got to be able to tie it all together. And so I don't think there's really anybody out there. So let me just give you a quick example. So like in the RBR context, PI claim, member's riding his motorcycle intoxicated, is hit by another driver, okay? The hospital does an appeal, so you've got $469,000 in, outstanding claims. But we passed all the risk to the facility, so the full 469 went back to the hospital, and then you just coordinate all the different parties. There's just not a lot of people out there doing it. There's not right now.
Perfect. Thanks, Doug, very much. So again, hope everybody enjoyed the webinar and there's enough information to supply you guys some aha moments. More importantly, we are here to answer any questions. So reach out to us at any point. We can do a quick consultation. Obviously, there's not a charge to do that. It's really about the assessment of what situations you may have run into, an assessment of what got done and paid maybe in error that we need to go back and retract. As well as any kind of future claims that have yet been paid that are on the horizon that you kind of see, especially since most groups are rounding out a 1/1 renewal. We certainly want to make sure those parties get in line and quickly resolve themselves, hopefully before the 1/1 or thereafter, to ensure you have a smooth kind of renewal period, either be it in the plan year or the treaty year with stop loss. So thank you guys very much. Doug, any last words here?
No, I appreciate it as well, and I look forward to working with all of you.
All right. Thank you very much, Doug. Thank you for your time. Thank you, everyone, for joining. Have a great afternoon.